Willow Creek Springs presents Healthy Living with your host, Joe Grumbine.
Well, hello and welcome back to the Healthy Living Podcast. I'm your host, Joe Grumbine, and today we're going to take a little twist. A lot of times this show talks about medicines that are kind of, old or alternative, and technology isn't often a subject matter, but sometimes it is. Today we've got Hunter Ziesing. He's a co-founder of head of partnerships. I'm gonna forget all about that. This guy has got a project called Longevity Health, and we had a great conversation yesterday. And this is cutting edge technology. It's combining applications, AI, um, health records, network, a community of medical professionals, and a personalized solutions for people to find their own longevity plan. And Hunter, welcome to the show. I hope I didn't botch that too bad. I'm dealing with chemo in my head right now, and sometimes I just can't even read.
No, not at all. Thanks for having me on the show. And by the way, crawl, walk, run. You went right into the run as to what our dream of building with data. And we can go through kind of some of the myths of longevity and what's being done in the marketplace today, and hopefully getting to where you want to go, so we can prevent shit like happened to you. Right.
Absolutely. Longevity has become quite a topic. We talked yesterday. I told you about I began a biohacking journey about 7, 8 years ago, and listening to guys like Dave Asprey and Dr.
Peter
Gunn.
Attia.
Yeah, and just opened my eyes to a different approach, different ways of looking at things. You grow up with the food pyramid, and you come to realize that, wow, things aren't always what they appear to be. And I listened to a lot of people, tried some things, and sort of found my own way by experimenting. But there's a lot of people that realize, I think, today that there's a lot of options that we're not predestined to, live till you're 72 and then, crap out. It's like, shoot, 72, you're just getting started these days.
Yeah, well, unfortunately, our medical system, as you probably found out, is somewhat reactive. And the incentive system in the medical profession is, all based on actuarial tables as to what has gone wrong. And then they look at data set and how to treat it, as opposed to, being more proactive. And unfortunately, part of it's science, because there's a lot of new technologies to detect things,
Sure.
which we do at Longevity Health. And we try to tie all that together and give you a more comprehensive view of yourself. But part of it's reimbursement. A lot of the things that your insurance company will pay for is after you've already had the illness, and such as you went through yourself. Fortunately,
Right.
you, for the most part, lived it. Our goal is to try to get a lot of data around you and find those problems before they occur.
Which was obviously preferable. They have this thing they call standard of care, and it really doesn't say anything about getting well. It's about care. You get into the system and you get into a treatment program, and they treat you pretty much forever. And I think that's whether it's intentional or not, it's not a recipe for health, and it's not a recipe for overcoming a serious illness. That's for sure.
Did you know that Medicare, which largely pays for end of life care, is like probably half of the healthcare budget for the government, if not more, that insurance companies get paid more for sick patients than they do for healthy patients.
Exactly. Exactly. So you got to wonder, you think about this, pharma companies, insurance companies, these are corporations that are run by a board, and their mission is not to make you well. Their mission is to make money for their company. And, it's not wrong. It's what every company does. But we got to be mindful of that, I think, as we're, walking through our journey to health and realizing who are we reaching out to. And I am always telling people you got to be your own advocate. You've got to be the one who cares the most about your health, and that's how you're going to find it.
So in that regard, and I'll get into kind of what we do now and what we're trying to do. But I'm curious, as you went through your cancer, how much of your care and diet or of your whole regimen to cure this was out of pocket and organizing your own tests and your own biohacking versus just doing what your insurance company told you to do and your doctor did?
Oh, more than half of it. And I was able to get my doctor to do my protocol as an emergency action. The tumor had gotten so big, I wasn't getting cleared to do what they wanted to do. And I did my research and I found a neoadjuvant chemo solution that was much safer and much less long-term damage risk than what they were proposing. And I got them to approve it. So I actually got my insurance company to pay for a cocktail that I came up with through my own research, and it was remarkably successful because I stacked it on top of all these other therapies that didn't cost me a lot, but took me a lot of time to research and develop.
So you were lucky to get it paid for, but did you also have out-of-pocket expenses as well?
Oh, yeah, thousands.
Yeah.
I mean, yeah. I'm on the hook for 20 grand right now, right, that I'm paying for. Yeah, just, you know, this is really just getting started where they're talking.
Yeah. Well, I don't know, what do you want to talk about next? You want to hear about what we're doing and what
Yeah,
we're
well,
trying to
I love to hear the origin story of this. I'm really kind of excited about your dream because it seems like it's a good one, and it seems like it has a lot of promise to help a lot of people and be a workable model. But I always like to hear how somebody who comes up with a dream like that gets there. So why don't you tell us your story about how you came to this longevity health?
Yeah, sure. So I was a successful Wall Streeter until my early 40s, and I lost my dad to pancreatic cancer, and five of my friends under 40 all had various infectious diseases, largely which were not entirely preventable, but they could have been detected through a better health regimen. It just wasn't because they were ignoring, my one of my best friend's wife died because she had a lump in her breast and she ignored it. But if she had something to detect things earlier and to monitor, that might have saved her. To a good friend with stomach cancer that was easily detected, and it was all after the fact cases. So I left my Wall Street career and I started a foundation called the Charity of Choice Foundation, and we did large cancer fundraising events in partnership with Livestrong. I did that for about 15 years. And learned a ton about the science and research going into cancer prevention and cancer research. Livestrong was more of for the survivors. We were more for the
Right.
for detection and cure. So I was always motivated. I've always been an athlete. I've always been healthy, and I hated seeing people get sick that didn't have to be sick.
Right.
But I was always saddened by the fact that people have the tools out there but don't know how to use the tools. Then I went to a startup for a couple of years called Paceline, where we motivated people to exercise by giving them a Garmin or an Apple Watch and calculating the elevated heart rate minutes slightly above your resting heart rate. And each week, our users would elevate their heart rate for up to 150 minutes. Each week, we would give them rewards. We built that to 1 million users, and what we learned there is we could change behavior because people would fight to get to their 150 minutes each week to get their rewards. It was really cool. We give them a streak. So each week you'd be week 1, week 2, week 3, week 4. And people would literally on Sunday afternoon when the clock was ticking and they hadn't got to their 150 minutes, they would run outside and walk the dog and, get that last 10 minutes. And
I love it.
we'd only give them $1 a week to work out or other partner rewards. And what we learned from that is you can change behavior by offering people some incentives.
Sure.
I also think you need do a lot socially to motivate people. So that got my wheels ticking. Like, okay, there's motivation. So I started this company called Health Hub, which was to amalgamate data, HIPAA data and wearable data. I thought that was a cool idea. Let's get all this data and put it in one
Sure.
pot and use that data to motivate people and make health decisions. But I quickly learned that you really need clinical science to change health. You can use the data and motivate people, but that's more gamification and
Right.
rewards. So I hooked up with Longevity Health, and for commercial sake, it's longevityhealth.me. And Jesse Levy's my co-founder, who had a history of heart disease in his family. He's in his early 40s, lost a few of his family members to heart disease, started biohacking, looking at read Peter Attia's book like all of us, and got really motivated to, get into functional medicine. And so we've built a really cool clinic. It's expensive. Now, I mentioned earlier, walk, crawl, run. So walking right now is this clinic where we charge $10,000 a year.
Hmm.
And we take your HIPAA records. We do a blood test, a bone density scan, a VO2 max test, a sleep study, gut biome test. In some cases, we do RNA, DNA. Some of our clients are doing genome sequencing, which gets a little bit more expensive, but
Sure.
we do a whole series of tests. We do a long interview with you and the clinical team. You get a doctor, Jahan Fahimi, who is the head of emergency medicine at UCSF, is our lead doctor. We give you a clinician, a dietitian, and a exercise physiologist, and we develop a plan that's specific to you, not to me, but to Joe.
Sure.
What's your family history? What are you trying to achieve? And we look at all this data, humanize it, and we come up with a plan and make recommendations. In fact, this morning I just had my first consultation with one of our doctors, and I went through all my blood results and my DEXA scan, and I learned a lot about my body that I didn't know about, and things that I
Right.
need to be doing at my age, including strength training.
Okay.
So that's expensive. It's 11 grand a year. It compares to the bricks and mortar clinics that charge 20 to 30,000 a
Sure.
year, or you can go to Peter Attia and spend 200,000.
Exactly.
So we call our $10,000 platform the Billionaire Bundle. And for lack of better terms, you get what billionaires get for $10,000 a year.
I like it.
So that's our base product. And then we give everyone a Slack channel, and we are in your face 24/7 as much as you want to be. And then we retest every quarter rather than just whining and dining you in a bricks and mortar clinic with flashy teas and herbal stuff. We're kind of in your face. And we stay with you throughout the year. And then we retest and retest. It's a great program. We've had amazing clinical outcomes. I'll shut up there. The problem with that model is it's not highly scalable, and not everybody can afford $11,000, even though
Right.
it's half of what you would pay for a bricks
Even
and
if
mortar.
you want to, if you can't afford it, it's not something that you can do.
Correct.
So I think that we were talking yesterday, and this model that you have is it in effect, or is it still just in the planning?
So the new model's in effect. In fact, I might even be able to demo it right on this call. It
Oh,
might be
cool.
fun. We have a chat AI. It's an AI doctor that you can call, and it will interview you and talk about anything you want to talk about in your life. And then what we plan to, and it'll develop a plan for you right away. Immediately, it'll text you a plan based on what you discussed. The next version of that is we've already have a platform where we can store all of your medical records and all the testing data that we look at manually. But we want to do is merge the AI chatbot with the AWS server that stores all your data. And in addition to the tests that you have done through us, you might have already had other tests done yourself at
Sure.
Superpower or Function Health, or even Biograph, a genome sequencing. So we want you to just load all that data. We
Okay.
will use AI to analyze that data to make clinical recommendations. That's the next phase. We're building that right now. And then the dream phase is where it becomes completely automated, and you have an AI doctor 3 to 5 years down the road that will actually prescribe medicine. Right now,
And
you still
where are
need
we
a
at
human in the loop.
right now with this, with the progress of this? I mean, I know AI has got huge potential, huge strengths, but it's also got some weaknesses as it is right now. What's been your experience so far with putting all this data in and starting to ask questions? How's it coming back?
Great question. Two things. One, as much as everyone loves to talk about AI, consumers are not fully ready for AI. I mean, my analogy would be a driverless car. In San
Right.
Francisco, when I first saw them, I kind of ran for the curb.
Sure.
Now, people are San Francisco, Waymos are everywhere, and you're probably more comfortable in a Waymo than you are when you see a taxi cab, or when you're crossing the street, the Waymo is going to stop. Um, but right now, as we would put it, the other problem is that as AI is still hallucinates a little bit. You can
Right.
put all the stuff in ChatGPT, and it sometimes it comes out a little bit wonky.
Yeah.
So we need to train the LLMs to really interpret the data. We need to take AI to residency and learn to become a doctor, which will
Right.
take some time. And we need consumers, we need to make the AI app super friendly so you're comfortable chatting with it as much as you would getting into a driverless car. So I don't think AI is quite ready yet, nor are the consumers. They still want a human in the loop.
Sure. Sure. And I think I agree with that. I use AI in a limited scope, but I use it more and more, and I'm more and more, finding a place where I go, okay, I can rely on that, and I think it's going to continue to evolve that way. One of the questions I have in my journey, I've learned a lot about cancer and the detection tools that they have, and frankly, by the time you can see a tumor or a lump, it's got, hundreds of thousands of cells, and it's already ready to metastasize. And cancer can be detected at a very low threshold in some cases. There's emerging tests happening all the time. But I found with the standard of care, I couldn't get doctors to order tests. I was requesting a number of different tests, and the doctors are like, "No, we're not going to do that. We have this one tool. That's what we use." Knowing that there's so many different tools, and it's only going to become more and more as technology and AI, in fact, is probably developing uh, different models of tests that can be given. How, how are you looking to develop sort of that roadmap of what's available?
It's funny you should mention that. I just got off the phone with our one of our lead doctors today doing, my interview post all my testing. And at the end of the call, we ran out of time. She said, "Have you done any cancer testing?" And I said, "No." And that's something that I think we're exploring and we're not trying to upsell our patients, but we're constantly looking for new tests coming on the market, especially if it's something that the individual thinks they need. If they've got a cancer history in their genes or their DNA, or something in their blood test pops up. And I analogize what we're doing, and not to say that all these test companies out there today are commoditized, but the test companies today sort of remind me of the diet du jour. There's been 12 diets since I was in college,
Sure.
and they sort of trend. And right now, blood tests are trending. Get a $300 blood test and it solves all your problems.
Right.
So I can see us hopefully becoming the curator of all these tests and using AI. Right now we use clinicians, but using AI to sort of interview you, which I'll show you in a minute. We can demo this
Yeah, yeah.
and then determine which tests are right for you. And then it's going to be up to us to be the authority on those tests. And we will never take, we'll never build a marketplace of these tests. We'll just, if we get a discount because we're this huge company, we'll just refer you to the testing company, and then there'll be an API that downloads the data into your longevity health account. So it's a long answer to your question about cancer detection. Yes, I'm not the authority on that, but our doctors are constantly looking at new tests and new ways to help people. I mentioned the 6 that we offer right now. In 5 years, maybe we won't be doing DEXA scans anymore, but right now,
Right.
DEXA scans and blood tests give you a lot of information.
So basically, what you're saying is you're going to have a whole toolbox full of tests that you have available, but not necessarily going to recommend the same ones for every client.
Exactly right.
Perfect.
Um, if you don't mind, I'd love to. I haven't done this
Yeah,
demo in
yeah,
a
let's do
month.
it.
Let me just. So I put my name and my email address and I can send you the link uh,
Yeah.
to the plan. It's longevityhealth.me/free dash longevity dash plan. That's a mouthful, but I'm just putting
We'll
this
put
in
that
right
in the show
now.
notes.
Let me see if this calls me. It might be a little bit wonky, but hold on. Let me see. I just put it in
Yeah.
here. We'll see if it calls me. And
It's cool to watch this in development. I'm I'm a visionary like you in that way. I love to see these things actually come to life.
All right. I just said call me. The internet here is a little funky. It hasn't called me yet. 720. What's going on? If not, I can have you try it. Maybe I should wait a minute. Hold on. It looks like it's working.
All right.
I can have you do the call.
There you go.
Hold on. Waiting for call. Should call me right away. Hopefully you can edit out some of the delay here.
Yeah, it's all good.
I don't know why. It could be because my you mind if I can't get it to call me, you mind trying it on your end?
No, not at all.
Here, I'm gonna put it in the chat.
Okay.
It takes like 10 or 15 minutes to go through the whole thing.
Okay.
So you can just cut it off whenever you want.
Yeah.
Let me go to, I gotta find you on here. Where is our link? I got so many pages open here. Oh, we're on Zoom. Duh.
Yeah, we're on Zoom. Yep.
Okay. Chat.
Yeah.
All right. I'm gonna I'll mute my my end when you do this. So share chat. Okay, here, click on this and put your name and email and phone number in there. And it's gonna call you on your cell phone. Put your cell phone on speaker when it calls you.
All right.
You're gonna love this. And again, it's wonky, but it's really cool.
Okay, here we go. On call me.
It's in beta right now, so maybe it's not working.
Yeah.
It should call you right away.
It says waiting for the call, but we haven't got a call. Oh, here we go.
It's Gonzalez.
Hello.
Hey there, Joe. I'm calling from Longevity Health. You signed up to receive a longevity plan with us. Is this a good time for a quick chat, maybe around 15 minutes?
Sure. Yes.
Thanks for taking the time. To get started, I'd love to hear why you chose to start a longevity program. What's driving you to explore this path?
I want to live a long and healthy life.
That's a solid goal, Joe. When you think about living a long and healthy life, are there specific things you want to be able to do as you age? Like, are there activities or experiences you want to keep enjoying, or maybe new ones you want to take up?
I want to maintain a strong and healthy lifestyle. Very active.
Active is a big part of your vision for the future. Are there any particular activities or sports you enjoy now that you'd like to keep doing as you get older? Maybe some new ones you're thinking about trying?
I like to hike. I like to bicycle. I like to fish. I like to farm in my garden.
That sounds like a fantastic activity. So, hiking, fishing, and gardening all keep you moving and connected to nature. It sounds like you want to keep that up for as long as possible. Is there anything else, maybe on the mental or emotional side, that you're hoping to maintain or improve as you age?
I would like my cognitive skills to remain and maybe improve.
Hi, this is Joe Grumbine, and I wanted to share an update. The platform that hosts this podcast has made some changes to the subscriber settings, and we have a number of subscriber-only episodes that we offer to the supporters, and for a minimum of $3 a month, we can get you signed up. And if you're already signed up and you're having some kind of trouble locating these episodes in the other platforms, I would say maybe the best answer is to unsubscribe and then resubscribe. I'm sorry for the hassle. I don't have any way to make a change, but I'm very grateful for all the support. Thank you.
All right. So keeping your mind sharp is just as important to you as staying physically active.
Yes.
That's a great balance thing. So to sum it up, you're looking to maintain a strong, active lifestyle with activities like hiking, biking, fishing, and gardening, while also keeping your cognitive skills sharp. Is there anything else you'd like to add or any other goals you have in mind?
Just a disease-free life, a healthy lifestyle.
Got it, Joe. So living a disease-free life and maintaining a healthy lifestyle are key for you. Now, let me explain how our program works. We start with understanding your why, which we've just talked about. Then we move on to the how, where we look at your current health, lifestyle, and any medical history. Finally, we get into the what, which is about specific actions and strategies tailored to you. It's important to follow this order to make sure everything aligns with your goals. Does that make sense? And are you ready to dive into the next step?
Yes, but first, you need to know that I have squamous cell carcinoma that I'm in the process of overcoming right now.
Thanks for sharing that, Joe. It's important to know about your current health situation. Squamous cell carcinoma is something we'll definitely take into account as we move forward. Now, before we dive into creating your personal what plan, I wanted to remind you of we're focusing on tackling chronic diseases, especially what we call the four horsemen: heart disease, diabetes, dementia, and cancer. These are the big ones that can shorten your lifespan and health span. We're also aiming to maintain and improve your mental, physical, and emotional health and performance in the years to come. So the what we're about to create for you will focus on concrete actions to do just that. Sound good?
Yes.
All right, Joe, I'm creating a what strategy tailored to your personal goals and life. Hey, Joe, your what plan is ready. It's all about keeping you active and healthy, focusing on maintaining your cardiovascular health, boosting cognitive function, and supporting your recovery from squamous cell carcinoma. That includes a mix of exercise routines, nutritional guidelines, and cognitive training to help you achieve your goals. The plan has been sent to you via email and SMS. Please review it carefully. And if you have any questions and wish to make changes, don't hesitate to call us. We're here to help you adjust the plan to best suit your needs. Take care and keep up the great work.
All right. Thank you.
So that's our early beta. It's still a little bit buggy. It should have gotten into more detail. So when you told him about your health, it should have gone into a lot more detail. Like, what's your treatment you're doing now? Do you need additional help with that? Or is that just, you're
Right.
just letting me know? Then and you were pretty generic with your,
Yeah.
so like if if you started with that, and this is why we have to improve the bedside manner. So it needs to learn how to really dig into, like a doctor would, right? So if you call it back another time and you can make up shit. It's amazing
Yeah.
how much detail it'll go into. Like I said, yeah, I've been reading about Peter Attia and I've got ankle issues. My mom died of dementia, and it just lit up all this stuff. And then when it sent me my plan, it included all that stuff. So you get the idea. I'm just trying to show you.
Yeah, and it sent me over a plan, and it's got a bunch of stuff on it that's reasonable, and like you said, it's in development, but at this stage of it, I'm gotta say it's impressive. I can see where it could go.
Yeah. I mean, and it's like I said, right now it's crawl, walk, run.
Right.
Having this clinic and charging 11 grand a year gives us the ability to really humanize what people still want. But that, you asked me earlier, what's the long-term game, is to
Yeah.
automate everything in people's lives specific to your individual biomarkers and individual goals. It's pretty exciting. What we don't want to do is just become a test company and try to sell you on the latest cancer screening.
No, absolutely. And we were talking yesterday about, the difficulty of attracting the right people to this clinic model and getting to the place where you can have a community of people that are using this automated system that ultimately the more people use it, the better it gets. It gets smarter as it gets more people involved and has more data points to work from and more more of everything to make these decisions from. So is there some sort of a timeline that you can see biomarkers happening here?
Yeah, so right now we're focused on the clinic, growing
Hmm.
the clinic, keeping the clinic. We're in New York, California, Florida, and I think we're expanding into Texas, eventually be in all 50 states.
Nice.
We're also toying with the idea of a $6,000 product
Okay.
that will have human in the loop. Maybe you won't get a full-time physician. Physicians are expensive, but we'll have a
Yeah,
clinician. But we'll still look at lots of different data. We won't
sure.
just give you a blood test and charge you $500. It's still going to be expensive. Then we are probably going to consider raising some seed capital later this year to really build out the AI product to make it super user friendly,
Nice.
bedside manner, much better than you're talking to right now. And we've already built it. It's on another server. And then to make it so it's just really easy for consumers to download their data and then provide some advice. The timeline for that is, sometime later this year. And then we'll do a large beta test with it in 2026. And if all goes well in the regulatory environment and the consumer environment goes our way, then we'll be able to roll it out in 2027. So it's a ways off.
Well, on one level, especially with my experience recently of dealing with, dozens of doctors and trying to find answers, one of the biggest problems that we have as patients is getting the time of a doctor, getting the attention of a doctor, getting an appointment even. And so it seems that one of the positive elements of this, especially as it gets to be more refined and has, some real medical advice that can lean to you, you'll have accessibility. And I think to me and many, many patients, there's a huge frustration of, I need to find answers. I got to wait 3 weeks to talk to a doctor. I talk to the doctor, I get 5 minutes of his time and sent on my way. And it seems like this type of a tool will give people a more robust system to find these answers that they need.
And to some extent, you can do it on your own. It's
Sure.
called Chat GPT, and the chat and all the models are getting better and better and better. Nobody curates it. Nobody's trained AI on residency yet, and that we hope to do that. Maybe we'll get some help from our friends at the Mayo or the Cleveland Clinic, but I think we're going to end up doing it. Um, and if we can arm you with information and make clinical recommendations, even if we can't prescribe the medicine with AI or give you a doctor, we can make referrals, or you go to your doctor and you're more informed now. I bet you know a lot more about Joe Grumbine than your doctor does. And when you go
Oh,
in, you probably spend 20 minutes educating him on where you are,
I'm
right?
the world's foremost expert on my cancer. I
Exactly.
guarantee you that.
So I have had allergies my whole life, and I finally, after paying for, braces and schooling for my kids, I'm finally focusing on my own problem.
All right.
I went to see an allergist, and I spent 20 minutes on intake, 15 minutes with a doctor, and then I left, and they didn't even take a blood test or do a skin test. I had to make another
Wow.
appointment because the insurance company won't reimburse it unless I come back I already knew I already knew what I needed before I went in there.
Right.
It
And they
just
wouldn't
pissed
give it
me
to
off.
you. Yeah.
So if we can arm people with their own data, clinical recommendations, maybe the doctors will embrace it. And maybe over time, some of the tests or treatments like you found and including functional medicine will become reimbursed by insurance companies. And more so than, if you go to your HSA plan today, they're probably going to say, yeah, we have a gym membership and we have a deal with Aura Ring. And
Right.
you can get a free Aura Ring and a gym membership, but that's not going to solve your problems because
I don't know.
everybody in the company's got different problems. And if I know their problems, I can be more specific as to how to solve those problems. That's when you go back to the insurance company and said, look, I did the work. You you want me to be healthy and you don't want me to cost you're working for your company and you get sick, you're going to cost them a shitload of money. But if
Yeah.
I can be specific about solving your problems, you're going to be happier, you're going to live longer, you're going to be a better employee. But it remains to be seen if we can get reimbursement for these tests. But I think it's coming.
Well, I think the future's bright. And Hunter, I'm looking forward. This is a lot of times I get guests on. I say, well, if there's more to talk about, have you back. I'm actually looking forward to hearing about this as it's developing. So definitely we'll have you come back as this thing is progressing. And why don't you give our listeners runaround on how to find what you have available today?
Sure. Just go to longevityhealth.me, longevityhealth.me. And again, right now, our real focus is the high-end clinic. Uh, and but if anybody wants to email me, it's hunter@longevityhealth.me if they want to try our beta, which I just showed you, and there'll be better versions of that. But again, the focus right now is the clinic. That's where our mindset is right now, is really helping people in that regard.
Excellent. Well, thank you so much for joining us, and I'll be playing around with your beta for a little while. We'll see what else he has.
Yeah, I'll send you the new version when it comes up. It's still a little
Cool.
wonky. There's some delays and whatnot, but it's
Yeah,
going to
yeah. But it's interesting, and it's the beginning of the future. I love it.
Do you remember, lastly, do you remember the movie Her with Joaquin Phoenix?
Yeah, yeah.
He falls in love with a computer.
Right.
That's the future. You should see the stuff that we can do with geriatrics and people with Alzheimer's.
I
It's
can only imagine.
Yeah. Hopefully you won't need it.
That's my plan, exactly. All right, Hunter. Well, thank you again for joining us. This has been another edition of the Healthy Living Podcast. I'm your host, Joe Grumbine, and thank you for listening. We'll see you next time.
This has been another episode of the Healthy Living Podcast. We produce this show so that people can share their stories, people that have overcome obstacles, people that are undergoing obstacles. We're building a community of health-minded individuals. If you're interested in supporting the show, please leave a review on the platform you're listening to it on. If you're interested in becoming a guest, please send an email to itsjoegrumbine@gmail.com, or you can send a note into the notes section of the podcast. All right. Well, thank you for supporting this show, and we hope you've enjoyed it.